Good morning. Welcome. My name is Julie Yerkes, and I am the Community Engagement Lead for the Partnership at Drug Free New Hampshire. Thanks for joining us today on this Facebook Live, which is where we at the Partnership, we explore current prevention initiatives around the state of New Hampshire. And today we're really excited to have Liz Brochu with us. Liz is the Youth Services Director and the Substance Misuse Prevention Coordinator at CADY, which is Communities for Drug-Free Youth. And that's in the Central Region Public Health Network up in the Plymouth area. And they have a catchment area of a few towns in the Central Region. And if you're not aware, we have 13 public health networks in the state of New Hampshire. And each one has a substance misuse prevention coordinator like Liz. So if you don't know who yours is, we can help you find that out. And Liz is also the Certified Prevention Specialist of the Year a couple of years back. And so we're really excited to have her. CADY is, his mission is to help youth make healthy and safe choices by working with schools, parents, youth themselves, and communities to prevent and reduce youth alcohol, tobacco, and other substance use, and really promote those healthy environments and those promising futures, which is what we all want for all of our youth, our young adults, our adults, and our elders as well, right? That's what we want for all of our communities. So October. Here we are, mid-October, and it is Substance Use Prevention Month and Bullying Prevention Month. And we really thought of CADY because of all the great prevention work that they do. And in particular, this exciting new strategy that they've been implementing in their region. So I'd like to welcome Liz and thank her for being here. And Liz, you want to say hi and introduce yourself?
Absolutely. Thank you so much, Julie, for having me. This is very exciting. That was a great introduction. I'm very humbled. Thank you so much. This is a wonderful program that we were able to bring on into New Hampshire, the Getting to Why. And I'm just so thrilled that prevention in New Hampshire has been able to have this opportunity to look at this program. We actually had a prevention professional meeting in 2019, I believe.
Yeah.
And we had, I believe, the state, but BDAS, they brought in Up for Learning, and they did a presentation on Getting to Why. So that really sparked a lot of interest with a lot of New Hampshire prevention professionals. But of course, COVID happened, so it was kind of back burner. And one of our social workers from our community really brought it back to top of mind for me. And so I was able to reach out to Up for Learning. They are fabulous. They did a wonderful job kind of bridging that gap, allowing me to understand the process. And we're just so thrilled to be able to bring it into New Hampshire. So we were able to bring it in 2021.
Okay, I'm going to stop you there. So what is it? So what is Getting to Why?
Yes, so Getting to Why is an evidence-based practice. It is designed to increase youth health literacy and self-efficacy, community engagement and knowledge, and protective factors through data analysis and the reflection and action planning. The kids are actually doing this data analysis themselves. So we bring in groups of kids, and they're able to look at their own YRBS data, their local data, regional as well as statewide, and they're able to see what is going on within their peers, like what is going on in their schools, their communities. They look at what are their schools doing well. And they get to celebrate the achievements that their schools are doing well, but they also are able to look at this data and see what are some needs. So they're looking at that needs assessment. What are those risk factors that are bringing maybe some high risk choices that youth are participating in, and then they're able to look at solutions. How are they going to be able to raise awareness of these issues and find those solutions moving forward? So that's pretty great.
That is great. And so you said that you were able to do it in 2021. Can you tell us a little bit more about that? Like what it looked like, how like who was involved, and then we'll start with that.
Absolutely. So we were able to bring in two of our region's local schools. So we brought in Plymouth Regional High School. And we also had Newfound Regional High School. We weren't able to bring in Linwood, unfortunately, because they do not have the participation rate. So that's changing this year. But we're going to be, so we brought in those schools. We had 2 teams per school. So we had 2 teams of 10, 20 kids per school. And they looked at their YRBS data, that youth risk behavior survey, and we brought them all together. We were all masked. We were all social distanced, but the kids loved it because this was really the first activity outside of school. They were able to take a bus and go out, and so it was really exciting for them. And they had a wonderful meal at the Common Man Inn. Can't like say how much food is important and essential to teenagers, especially really good food. So that was great.
It gets me to meetings, that's for sure.
Exactly. But yeah, it was fabulous. Then the Up for Learning, they did the whole thing. So they came and they presented the information. They trained the kids. We just sat back and watched, and it was phenomenal. And after that, I was like, this has to go throughout the whole state. This is so important. And we actually had several other people there from the state. We had someone from UNH there, and we also had one of my counterparts at the state, Darren Smith, another SMPC, was there to look at the program, and she loved it so much she brought it back to her region, and she has been doing that the last several years as well. So yeah, so once you catch on, it's an aha moment that the kids should be doing this. This is something they're taking this survey. They need to be aware of the results and being able to take that to the next level.
So, I mean, we know that young people being involved, right, in anything that's like about them, right? We take that motto from the Disabilities Act movement, right? Nothing about us without us, right? We know that that's the most effective way to do really anything, right? Because that involvement, they make the meaning, they share with us, what it all is, right? We can look at stuff, data, we can look at questions, we can look at answers, but it's really having that youth perspective and having them make that meaning of it. So we know that is a really effective way to get them involved, to see the best outcomes. What kind of outcomes did you see? And you say it was amazing, like this, like it really struck you as something that has to go bigger. Like, can you be a little more specific around like what you saw happening and what those outcomes were that after that day of being trained? And obviously the kids, I'm sure, looked at me like engaged, and like you saw their demeanor being highly impacted. But what else?
Yeah, absolutely. We had well, the kids will go back and then they will share this information with their peers. So they'll bring it back to the greater population in their schools. What we had, one of the outcomes, we had one of the seniors who was present, Mackenzie. She did her senior project on the Getting to Why and the YRBS. So she was able to present, did like a mini Getting to Why for her school, her class. So that was really exciting to see her actually take this process, make it her own, and just blast out that information. It was a wider scale, and she brought the YRBS and raised the awareness of these issues to her class, which is great. Another outcome, the students are really picking those top priorities to work on and move forward. Pemmy Baker region, their school, Plymouth Regional High School, they picked vaping. Central New Hampshire was the highest incidence of vaping in 2019. So that was pretty eye-opening. So that was one of their initiatives that they wanted to work on moving forward. So they focused on their projects, as well as they focused on youth binge drinking, underage drinking, as well as marijuana use. So that was Plymouth Regional High School. Those are their priorities. Newfound Regional High School, their priorities, they actually chose 4. So they went a little above and beyond. So
High achievers.
Yeah, exactly. They chose 4, and one of them was the healthy relationships and sexual education, because they found that a little more than 10% of Newfound Regional High School students felt that they were ever physically forced to have sexual relationships when they didn't want to. So that was really scary for them to think about. 10% of their peers were feeling that they were physically they had to have physical intimacy without wanting it. The number 2 was mental health. In Newfound Regional High School, 43% of students felt so sad or helpless almost every day for 2 plus weeks in a row that they stopped doing some activities. So that was really surprising to them. So they wanted to focus on that. The third one was marijuana use before the age of 13. And the fourth one was student use of methamphetamines. So those were pretty big topics for these students to pick. And the Newfound was seeing a higher incident rates than statewide. So that was also very scary for these youth to see that their school was above statewide average.
So let's. I'm going to push a little here.
Yes, absolutely.
Scary for them to see. So that might indicate to some folks that they shouldn't be seeing it if they were scared. Can you tell me why you think it's still important, even though it was like a little alarming? Like how does having caring adults look at this with them? I really think a lot of adults see this data, but young people don't. And so I love that they were seeing it and making meaning of it and wanted to take action on it. But what about that, surprise or that, scary? Like how do you work with them to make sure that, they still feel safe and empowered and not scared?
Yeah.
Because I think that's a question a lot of adults or parents have around this survey in general, is should we be asking about these things? And so I'm curious if you can share with us how you maintain that like safety and when talking about such difficult things.
Yeah. Well, I actually asked them that question. Are these questions concerning to you? And they were like, well, this is real world. This is what we're seeing. So a lot of them are already engaging, or they see it in the halls, or they're aware that this is happening. I think seeing the numbers is alarming, just because it's right there. It's not just passing in the hallway. It's right there in their face. This is what's happening in the community. But honestly, I think that they feel empowered knowing this information. We are living in a world where kids want to know things. They want to know things, and they want to be solution focused. They want to be part of the helping the problem. They want to be part of the solution. So when they're faced with a problem, they want to look and to see what they can do to help. Some of the things that they did with this information, they did all sorts of projects to raise awareness, and they worked with younger students at the elementary school level on how teaching healthy relationships, not only red flags of a maybe a bad relationship, but also the green flags of what a relationship would be. So these students are brainstorming, how can we be part of the solution? And where should we start? Should we start with our peers? And then this is the conversation with the mentor. Well, with the peers, we need to be doing more awareness of the actual the activities, but how can we prevent this from happening? And they really come to the conclusion, we need to go younger, and we need to go, or what we say, upstream, and find a way to prevent or raise the awareness of what prevention is. And they went and they made these cute little red and green flags, and they asked these young kids what is different scenarios of what a good relationship is, and these kids got it. So I also believe that peer-to-peer education is very powerful, and they're going to make probably some more impact than maybe an adult coming in and going wah 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 wah. So if we can encourage more youth to know this information and be passionate about this information, they can make a big wave. And that's what the Getting to Why does. It raises the kids up and empowers them in knowing this information. So they are really the ambassadors in their communities, in their schools. And I don't think it should be something that we should worry about the kids knowing about. I think it gives them freedom and understanding about their own lives. And why make them take this huge survey and not understand why they're taking it?
Right.
And that was one of the things
that's a great point. Yeah. And I think that what, at the beginning, when you introduced Getting to Why, you said that it was evidence-based, which, there are best practices around talking and guiding people through, age appropriate, right? Developmentally appropriate ways about talking about sensitive issues, and that this is one of those age appropriate ways, right? To really increase knowledge and skills with that adult support. So yes, you're bringing them up with the proper supports, it sounds like, to really make the meaning in a safe way, and then be able to share it in a safe way, with others, with guidance, right? While the young people are doing it, there's adult guidance that know those best practices. So that's really exciting. And I think that peer-to-peer being effective, it is not just a feeling that you have. There's a lot of evidence behind that as well. So it's great. I want to be mindful of our time here. This is so great. Thank you very much. We put some resources in the chat. I did want to say that you mentioned one community was not able to participate because they didn't have the
The participation.
The participation. Can you share what that means?
Absolutely.
And then, share what that means. They didn't have the participation.
Absolutely. So we have a smaller school in Lincoln Woodstock, and their participation rate was too small. So the YRBS,
Participation in what? In the YRBS.
it has to be above 60% of the student population to be able to be relevant or be able to go back and be shared. Because that it makes the number too small, so we can't utilize that information because of the possibility of tracing that information back to the student, and that's one of the things the YRBS it's student anonymity, like all the way. So it's a private survey. The students' information is not out there. So
De-identified, I think is
yes,
what you say, right?
yes,
Like
you cannot identify these students. Yeah, so they are completely anonymous with that. So we have to have a 60% participation rate in order to receive our YRBS data, local data.
Right. And why do you think it's important that schools participate and have a high participation rate so that they can have this information?
Yeah, I think that it's the information is just a tool. It's a tool, just it's simply put, for schools to use for solution focused initiatives, for parents to use to understand what's going on in the school, and our communities to use. So it's that triple threat. We have to understand what's going on with our youth, so we can help them, because they're not, a lot of youth don't have that caring adult or an opportunity, or don't know where those resources are to say they need help. And this is a way for them to do that. And
even those that do have caring adults, it's a big world out there. There are so many influences that are beyond their control and the caring adults' control, right? There's a lot. But also what I like to saying is that you celebrate.
Absolutely.
Right? There's a lot of good information about what we're doing, like what we're doing well, right? Absolutely. Like what our communities are, what's going well in our communities in this survey as well. So to really celebrate the great stuff, and then also have knowledge about some of those risks that are happening, right?
Absolutely.
So that we're not, I like to, I think there's, we're not throwing darts at what we need to do in order to increase that community wellness, right? If we have some data, we can say, oh, this is an issue right now, let's work on that, as opposed to this other thing, that is going really well. We can celebrate that. One other thing that you brought up was the healthy relationships being, and I think that that's going on. We can see that changing a bit across the state. And I want to share, and Nikki, maybe you could share this too, is that at our next partnership convening on Friday, November 3rd at 10 a.m., we have these convenings. They're virtual, so you can just click on a link and join us. We're going to have Cindy Pierce, who is a author, a speaker. We're going to put it in the link. And she talks about healthy relationships, and she talks about sort of this change, that we're seeing a bit with the access to, the internet on wherever we go, right? And how we can work and talk to our young people a bit about, what they might see in some of the messages that are being directly or indirectly, sent to them, and the impact that that's having on the way they interact with folks, and feel about themselves. So she's coming. So great that you mentioned that, because we've seen that from the data, right? That's happening. So the partnership wants to increase our collective knowledge and skills around, supporting young people on that topic. And then in addition, as a follow-up, we're screening screenagers under the influence, which is another opportunity to learn more about what's happening in this realm of the influences that young people are experiencing online. So thanks for bringing that up, so we could do a little connection to some of our upcoming events as well.
Absolutely.
Thank you so much for joining us and sharing this. We've put a lot of resources in the chat. We have information on the partnership at Drug Free New Hampshire. You can check out Katie and all the wonderful work they do. Maybe Nikki, we could put on the Bureau of Drug and Alcohol Services as well, because then you could find your local substance misuse prevention coordinator if you're not already connected with them, and just kind of see what's going on in your area. And then be sure to join us at our convenings. And with that, Liz, any closing messages you want to leave our audience with?
I am just so grateful for being on, and thank you so much. And a big shout out for Cindy Pierce. I absolutely love her. She is one of my favorite people here. She's awesome. And I just want to say thank you. This is great.
Great. Well, thanks for sharing your morning with us, and stay warm.
Yes.
We'll see you soon. Thanks all.
Bye.